And good afternoon here from New York. Good morning if you're watching on the West Coast. Welcome to a very special live edition of States of America, honest conversations on the issues that matter most. I'm Ralph Aversa, and coming up over the next 20-25 minutes, we'll be bringing you a panel of both medical experts and expert reporters to answer your questions about the various updates regarding the COVID-19 vaccines. There have been a number of updates just this week with, of course, one authorized by the FDA and another maybe authorized by the end of the week. And actually, to get to that most recent update, let's bring in right now USA Today health reporter Adriana Rodriguez. Adriana, I feel like it was just yesterday where I was asking you, should we be wiping down our groceries? Not really, by the way. Now I'm asking you about this vaccine, vaccines plural. What's the latest update?
Yeah, so last time we talked, right, was in the spring. We didn't even know really what the coronavirus was. And then basically less than a year later, we have a vaccine, and possibly, like you said, two by Monday if the Moderna gets authorized this by the end of this week. So since that starting point sort of in January when the coronavirus was first genetically sequenced, we had dozens of manufacturers basically try to develop a coronavirus vaccine. Right now, we have the majority of them still sort of in preclinical trials, right? Testing on animals. We have a big chunk of them in phase 1 human trials. I believe right now we have one that's officially been abandoned in Australia. And then we have a couple that are basically at the finish line or very nearly there, which is a light at the end of the tunnel.
How did we get to this point so quickly?
Well, a lot of smart people working very hard. But basically, I mean, a basic vaccine would get approved over, very many years of testing and development. And with this vaccine, we have FDA authorization, which is different from a full vaccine of approval process. So that shortened the timeline, a lot.
Absolutely. Adriana Rodriguez, USA Today health reporter, who will be back in just a little bit to answer more of your questions. Adriana, thanks so much. All right. So as we mentioned, you've been sending in those questions, various platforms, whether it's Facebook, Instagram Live, Reddit, Google Forms. We have compiled some of the more frequently asked questions, and we have also got together a group of experts to help answer those. One of those experts, the director at the Mayo Clinic of the Vaccine Research Group. He is Dr. Gregory Poland, and he joins us now here on States of America. Dr. Poland, thanks for the time.
My pleasure, Ralphie. Good to see you.
Great to see you as well. I was watching some of your YouTube videos that you posted back in January about wearing a mask, social distancing, and avoiding indoor gatherings, so on and so forth. Here we are now, about 12 months later. What have these past 12 months been like for you since you first started uploading those videos to YouTube?
Yeah, this has just been an endless number of 12, 14, often 16-hour days, and not just myself, lots of other physicians and scientists, as we've been galvanized toward this goal of how do we not only gather the best science, but communicate that to people so that they're likely to follow it, and of course, develop a vaccine that would keep everybody safe.
A number of questions coming in about that vaccine. Let's get to them right now, Dr. Poland. The first one we'll bring up is from Shauna, who asks, what are the vaccine side effects and how long do they last?
Yeah. This vaccine, like all vaccines, have side effects. One thing to be really careful of, don't assume that a side effect that you're having means something has gone wrong. We expect for a vaccine that raises a good, strong immune response, we expect a sore arm, redness, tenderness, maybe some fatigue, a low-grade fever, a headache. That's what's been seen in these mRNA vaccine trials. Now, in younger people after the second dose, some of those side effects were enhanced. In other words, they occurred more frequently, maybe a little more severely. All of them resolve on their own and usually do so within hours to a day, day and a half.
The second part of Shauna's question was, if you get the vaccine, are you contagious at any time?
Yeah. So the vaccine cannot infect you. It's just a piece of the virus that you're getting. That's what's causing the immune response. Until you get both doses and have an immune response that protects you, you could still get infected, and if you got infected, transmit that to somebody else. Now, the good news is for both of these mRNA vaccines, the first hints are that 14 days after that first dose, people are already building up an appreciable amount of immunity. Nonetheless, they need both doses to be fully protected and not transmit it to somebody else.
Let's break this down for a second. When you say appreciable amount of immunity, does that simply mean that they can fight this off for the most part, that if they do get it, maybe they won't have severe symptoms? What are we talking about here?
Yeah, it's a little hard to answer that because, and I'm being a little vague because of the actual results. In that very narrow window between the first dose and the second dose, so that's only 21 days apart, and it takes about 14 days to develop antibodies. So in that narrow 7-day window, the protection looked to be about 50-60% against developing moderate to severe COVID. So we need a second dose to get it to the level that you've seen, in the press, where we're up at about 95%, regardless of age, gender, or medical condition.
Dr. Gregory Poland, the director of the Mayo Clinic's Vaccine Research Group, joining us here on States of America. Let's get to our second question, Dr. Poland, that came in from our audience. This person writes, I have allergies. I'm concerned about having an allergic reaction to the vaccine. Should I get it?
Yeah. I think this probably comes from the press reports of 2 anaphylactic allergic reactions in the UK. Those were not seen in the clinical trials. We now have about 75,000 people between the two of them who have gotten 150,000 doses of vaccine, and that was not seen. So I would say if you have an allergy against a component in one of the vaccines, you wouldn't want to get that, particularly not without any kind of medical advice and preparation to do so. But just general allergies are not a contraindication to receiving the vaccine.
Dr. Poland, let's get to another question we received, this one from a Google form, and this person writes, I had COVID-19. Should I get the vaccine?
It's a really good question because we know that people who have gotten COVID, where it was documented, later on did develop COVID again. We don't know how often that occurs nor how severe it would be. But what we're advising is if you've had documented, not I'm pretty sure I had it, but if you actually had it documented, we would probably wait 3 months before immunizing you, only because we want to first offer the limited supply to people who have no protection. So we're pretty confident that somebody who has had COVID is protected for at least 3 months, after which they start becoming susceptible again.
And Dr. Poland, this kind of goes back to, and these conversations certainly spiked over the summer when all of these antibody tests were going to market and they had varying degrees of reliability. So I guess this kind of speaks to what we've learned about the COVID antibodies since then, right?
Yeah. And, you're right, Ralphie. A lot of those early tests were not really very good, as we have found out. So, we've got to not only have symptoms, but a test. And the best test is the nasal swab, RT-PCR test, to know that you were actually infected as opposed to antibodies. It does have some context dependency around it, though.
Dr. Gregory Poland, the director of the Mayo Clinic Vaccine Research Group. Dr. Poland, appreciate the time and all the work you and your team have done. Thank you so much.
Yeah, thank you. Thanks for getting good information out.
Absolutely. Somebody else who's helped us do that throughout this entire pandemic is Adriana Rodriguez, USA Today health reporter. We welcome her back now in this special live edition of States of America. Adriana, I want to just pose this question actually to you as well, what I started off with Dr. Poland. These past 12 months, what has it been like for you to really cover this pandemic for us?
That's a great question. Obviously, it has not been as exhausting as the, scientists and doctors on the, front lines who have been saving lives and developing this vaccine and other treatments as fast as possible. But it has been exhausting, to say the least. I mean, it's also, I think what was most exhausting about it, I think it's just the lack of information and then the finding out, what's wrong and what's right, getting the data, because there really was no information and no data at that point. And a lot of the people that we talk to, and especially experts, if they don't know, how am I supposed to know?
Right. No, hey, as Dr. Poland said, he was even being vague as well in some instances, because this is something that we're all still learning about together. Let's try to answer some more of these audience questions that we received. And this one comes in from Shauna Barclay Visser, who writes, she asked on Facebook, what resources and repercussions are available to those who are harmed by the vaccine?
Yeah, so the FDA has had some monitoring programs for vaccines in the past before COVID even came in, but now they implemented a new one on top of what they already had. It's called vSafe. And so basically it's just a smartphone-based health checker. So it will send questions via text message or web surveys or something like that to ask about your symptoms, to ask about adverse events and whatnot. And so people who take the vaccine will be able to enroll in this program, and then they'll receive that questionnaire sort of through their text message or email or web survey. And they'll receive that daily for the first week after their vaccination, and then weekly for the next 6 weeks. And so that way, that reporting goes straight directly to the CDC. So they'll be monitoring these adverse events if they happen among the public.
Adriana, let's get to our next question. It comes from Enrique Diaz, and it involves both Pfizer and Moderna's vaccines, one authorized, one could be authorized, of course, by the end of the week. Both involving 2 shots, though, essentially the initial shot and then a booster shot. And Enrique wants to know, let's take this into a couple parts here. First, how are they tracking / enforcing the second dose?
Sure. So states have something called immunization information systems, and this is sort of statewide. So they'll be tracking systematically who got which shot, either Pfizer, Moderna, or whatever happens to be out at any point of time. They track when you got that first dose and where you got that first dose. So that's going to be statewide, so that healthcare providers know between healthcare providers who got what, when, and where. And so speaking, that means that you can technically get 1 dose at one healthcare provider and possibly get your second dose if it's still the same, manufacturer at another healthcare provider if they have it. However, that only happens within the state. So that means that you won't be able to get a first dose in Texas and then maybe a second dose in Arizona or something like that.
And that's a very interesting point, how so long as it's the same vaccine, Pfizer or Moderna, once it's authorized, you can get the first dose in one location, the second in another, so long as it's within the same state. Let's focus a little more on the when, though. You get that first dose. When do you have to get that second by?
So for Pfizer, the most optimal time is going to be 21 days. Moderna is a little longer. It's 28 days. The reason why I say optimal is because that window is flexible. And I say that with hesitation because obviously we do want people to get their second dose when they're supposed to get their second dose. But at the same time, there's a lot of logistics when it comes to a healthcare provider having whatever Pfizer or Moderna, So just in case a patient is scheduled, let's say, to get their second dose and their healthcare provider for some reason is delayed in getting a shipment or maybe doesn't have enough, doses available for them, I don't want patients to worry that, okay, well, that's it, I'm doomed. I can't get my second dose, or okay, I have to start over with my first dose. You can still get your second dose a couple days, even a couple weeks after the optimal window time.
Adriana Rodriguez, USA Today health reporter, joining us here on a special live edition of States of America. Adriana, another question coming in from Seth Lawson. He asks, is it true that an employer can terminate you for not receiving the vaccine if they decide it's mandatory? And then he, adds in, of course, excluding medical reasons or possibly religious beliefs, but for anyone else.
So we have to remember that this vaccine, as I had mentioned earlier, is authorized, not approved. So it hasn't received full approval yet. It's only just been authorized. And so that's why we sort of expect companies to not mandate the vaccine for right now. But saying that could change once it does get approved, and especially for healthcare providers. Most healthcare providers, well, not most, but in different states where, there's different laws regarding mandating vaccinations, some healthcare providers do mandate their healthcare workers to take a certain vaccine, for example, the flu vaccine. So we expect to see that when it does get full approval.
Do we know when that's going to be?
Timeline is unknown at this point. I mean, we have a lot more trial participants than we usually would have in a normal vaccine. Usually most vaccine or other drug treatments have a couple thousand. We have tens of thousands in each. So that's a lot of paperwork, that's a lot of data, that's a lot of observation time, and a lot of people to observe. In terms of when that will get approval, I'm not sure, but I don't think it'll be anytime soon.
USA Today health reporter Adriana Rodriguez. Adriana, thanks for appearing twice on this live edition of States of America and helping us out, along with all the great reporting you've done all year. We appreciate it.
Thank you.
All right, as we continue on this live edition of States of America answering your questions about the COVID vaccine, we turn to another medical expert. He is a professor of infectious diseases at Vanderbilt University School of Medicine and the medical director of the National Foundation for Infectious Diseases. Dr. William Schaffner joins us now here on States of America. Dr. Schaffner, thanks for the time. We appreciate it.
Good to be with you, Ralphie. Bring the questions on.
You've just been answering them nonstop for the past year. You want to just keep it rolling, right?
Right. This is Bill's pop quiz, right?
There you go. That's it. Perfect. Here we go. Because you and I are just meeting for the first time now, but I'm sure you'll be able to answer these no problem. And I know, Doctor, that your expertise is in policy. So let's actually start with this question that we received online from our audience. How are distribution plans being determined from state to state? And then I guess the second part of that, how is it being paid for?
Well, the paid for part is the easiest, certainly for the vaccine. We as taxpayers have already paid for this vaccine. So when you line up and roll up your sleeve, you won't have to reach for your wallet. It will be a free vaccine to everybody in the United States. The distribution plan has been determined according to a template provided by the CDC that goes out to all the state health departments. The state health departments had to really look within their own states how to create a statewide plan. They submitted that back to the CDC. There were always edits going back and forth, but on an equitable basis, largely on the basis of population, this vaccine, both vaccines, will be distributed across the various states. And each state will have its own quirks because, after all, we're a very large, diverse country, and there will be slight differences between the states. But by and large, we'll be singing from the same sheet of music. There'll be the basses and the sopranos, perhaps not singing exactly the same notes, but we'll be doing this in a harmonious way across the country.
I was going to ask, I mean, is the song being played? Is it listenable? Is it something that we enjoy hearing? Is this an efficient way to go about this?
Oh, it's a very efficient way. The state health departments have been working with providers for years and years and years, distributing vaccines that go routinely to the pediatric population. So they know how to do this. They know all the providers in their states and what they're capable of doing. And so they've organized this very well. The Pfizer vaccine, as you know, that's the one that has to be kept very, very cold. That's going to go to major medical centers and other hospitals that have the resources to manage the vaccine and the trained personnel. I think the Moderna vaccine, when it becomes available, we hope next week, will be distributed much more widely to pharmacists and doctors' offices and clinics closer to patients and more apt to be the vaccine used in rural areas.
Dr. Schaffner, let's get to our next question from our audience. We've actually gotten this question in a number of different forms, but we'll kind of summarize it here with this. Why were children and pregnant women left out of the trials, and when can we expect to see distribution to them?
Sure. We start vaccine trials very often in adults. And obviously, in this circumstance, that made double sense because adults were the population most severely affected. And so you can only do so much at any one time. So the vaccine was trialed in adults, and now we know that it's very, very effective. And now we can move our way down the age range and start doing trials in children. We would expect that those trials would be completed sometime in the summer. So at that point, the vaccination programs, everything going well, those vaccination programs can move down into children. Pregnant women also, it was thought ethically more appropriate to exclude them from these first trials. Now, there have been many, many discussions with the American College of Obstetricians and Gynecologists, experts in pregnancy, etc., that have decided that pregnant women may receive this vaccine currently. You have to be fully informed, be assured that everyone thinks this vaccine is going to be safe, not harmful to the woman or to the fetus. It's important to realize that women who are pregnant, should they get infected with COVID, are more likely to have a severe illness. And there's also a tendency to prematurity in the delivery of the baby. So we would like to offer this protection to pregnant women should they choose to receive it.
Very interesting. And there's been, as you mentioned, a lot of discussion on that as well. We get to our next question, Dr. Schaffner from Virginia Velasquez Cruz, who writes in, how safe are the vaccines from reactions? What kind of preservatives are they using in the vaccines?
So the vaccines are really preservative free. So that's very good. And we have to know that this vaccine is on the a little bit more on the tender and reactive end of the spectrum, such as other vaccines. Some of the adults watching have received the shingles vaccine. That gives you a sore arm. This one is likely to give you a sore arm. And there's a proportion of people who the day after vaccination might feel a little bit fatigued, have some headache, maybe have some aches and pains. This disappears usually within 24 to 48 hours. A very small price to pay in order to get the protection against COVID. Easier to deal with a sore arm for 3 days than a ventilator for a week.
Absolutely. We get to our next question from Guy Monroe. He had a question that kind of applies to a lot of things these days, Dr. Schaffner. Public trust issues are widespread, in part due to mistrust of the government and big pharma. How is distrust in the vaccine and distribution plans being addressed?
This is a wonderful, absolutely central question, because for people to actually come forward and receive the vaccine, they must trust in the medical and public health leadership of this country. And that's been somewhat eroded, unfortunately. And the whole development of this vaccine has had a bit of, if I may say so, a political veneer. That's kind of begun to melt away now that the election is behind us. And I think that's very important, because now the public health people and we physicians are now in the forefront speaking. We also have to recognize that populations disproportionately affected by the virus are people of color, ethnic populations in the United States, in our diverse country. And so we must establish trust with those populations, working with leaders in those populations, so that everyone there will have access to the vaccine and will have the information and be reassured that they too can make good decisions for themselves and their families. We'll be working on that very much in every state at the local level.
Certainly I think on the federal level as well too, though, Dr. Schaffner, you mentioned that with the election being over, as we move towards January 20th and President-elect Biden being inaugurated, is this a chance for us to kind of turn the page on a lot of that misinformation and all of the politicizing that went on with both COVID-19 and this vaccine?
Well, Ralphie, in answer to a question like that, I always say I'm speaking as a public health and person and as a medical person, not as a politician. But we certainly have seen already that the president-elect has put up an advisory committee full of people who have excellent credentials and are scientifically and medically rigorously based. These are people who have the respect of all of us working out there. And I think going forward, the entire response to COVID will have a public health and medical basis, not a political basis.
Dr. Schaffner, you mentioned as well how COVID has disproportionately affected communities of color. And here in New York, on Long Island, Sandra Lindsay, a nurse, a woman of color, was one of the first in this state to receive the COVID vaccine. I guess what is the significance of that? How important is that for others to see her receive this?
Well, I'm smiling from ear to ear because isn't she wonderful that she was the first person, the symbol of someone who worked so hard with patients and was eager to receive the vaccine. And she spoke so clearly and so definitively about how important that was and how thrilled she was to be part of receiving the vaccine. Light at the end of the tunnel, she said. And I mean, that was just a joy to me when I saw her speaking on television.
Dr. William Schaffner, professor of infectious diseases at Vanderbilt University School of Medicine, and of course, the medical director of the National Foundation for Infectious Diseases. Dr. Schaffner, thank you so much for the time again and all the information. We appreciate it. Happy holidays.
My pleasure. Same to you.
And thank you so much for tuning in to this special live edition of States of America, honest conversations on the issues that matter most. In New York, I'm Ralphie Aversa. Have a good one.